Perfect. You okay, yeah?
Yeah.
In this video, I am showing you how to treat low back pain in one session. Yes, you can have great results in just one session if you follow these techniques. This video is for professionals who have training in manual therapy, and it is not something to reproduce at home if you are not qualified. Patient complaints of low back pain that started a few months ago. There was no specific accident that caused this pain. Patient is having a desk job and prolonged sitting makes the pain worse. First, we start with an assessment. I have seen this patient previously, and he is for a follow-up today, so I've done a full assessment prior to provide any treatment. Best advice is to clear the red flags so you are safe to provide treatment. I start by releasing gluteus muscles on the side where pain is worse. I only have 30 min to treat this patient, so I need to be focused on the side that is causing issues. I start by using a roller. You can use a massage gun as well, which is very powerful, but not everybody likes the vibration from the massage gun. Spend a couple of minutes on the gluteus muscles to make sure that you release the tension properly. Most of the time I see that just but releasing the gluteus muscles, the paraspinal muscles, and even the quadratus lumborum muscle become released. Next step is to apply massage oil or cream and start using the blade to release the tissue. I don't need huge pressure when using this technique. After the blade technique, I start doing a deep tissue massage by finding the tender spots and adding pressure gradually. Most of the time is the paraspinal muscles and quadratus lumborum. I also use a massage tool to save my thumbs and fingers. You see 15 patients a day, your hand and fingers will be extremely tired and painful by the end of the day. I alternate between the blade and deep tissue massage. Where I feel that there is still a tender spot, I use the blade again, and then I apply pressure. It is more beneficial like that. I ended up this treatment with cupping therapy. I applied only 2 cups on the spots where the muscles were very tight.
Press a bit here. A bit tender?
Yeah, a bit.
When we get to there, I would suggest some ice, okay?
Okay.
Very important.
Just for 2-3 minutes.
Yes, no more than that. 3 minutes, yes.
And is it fine to directly apply on the skin rather than?
I would say no, use a towel or something,
Okay,
yes,
okay.
it's like a cloth, a t-shirt or something. Because ice can damage the skin.
Yeah, yeah.
Yes, why else? One more here. Is that okay?
Yeah.
Okay, yeah?
Yeah.
Little bit there. Feel the pull, yeah?
Yeah, yeah.
Yes.